If your child has been diagnosed with ADHD, you've probably asked yourself the question, should I try ADHD medication? And let's be real, it's a really big decision and it can feel very, very overwhelming. Hello everyone, I'm Dr. Yanina, cognitive psychologist, ADHD coach, and ADHDer myself. Whether you've been officially diagnosed with ADHD or you're currently deep diving into the internet rabbit holes, trying to figure out if ADHD might be part of your story, I've been there. Deciding whether your child should be taking ADHD medication or not is a tough and big decision. So today we're gonna break everything down so you can make an informed and confident decision. So in general, ADHD medications, especially stimulant ADHD medication, are often prescribed and are very, very helpful for kids struggling with focus, impulse control, or just staying on task. And did you know that about 80% of kids who try them see positive effects? So 80%, that's definitely a very high successful rate, especially considering other psychiatric medication. But let's be honest, even with these statistics, it's very hard to make a decision, and it's normal to be concerned how ADHD medication might be affecting your child's behavior and brain. Okay, so let's first understand how ADHD medication even works. So picture this, dopamine is like your brain's natural Wi-Fi signal, and for kids with ADHD, that signal is pretty weak, making it hard to focus and get things done. And ADHD medication is kind of like that Wi-Fi booster, strengthening that signal by adjusting dopamine levels. And stimulants like Ritalin, for example, or Adderall, do this by blocking something that is called the dopamine transporter. And that's basically a vacuum that sucks away the dopamine too quickly. So in simple terms, the stimulant medication will help to level the dopamine in your child's brain, and it will help to slow down the metabolism of the dopamine. And note before you ask, these medications don't make your kids feel like high or lead to addiction, when of course always they're prescribed properly and taken properly. Now I also often get the question, will medication change my child's personality? One of the biggest fears I hear from parents is, will this change my child's personality? And the answer is no, at least it shouldn't. When the dosage is right, your child should feel more focused and in control without losing their unique spark. But if they start acting more like a zombie or seem irritable, it's usually a sign that the dosage is too high. And the good news is adjusting the dose typically fixes that very, very quickly. Now, if you already educated yourself on the topic or read something about ADHD medication and stimulant medication, you probably noticed that there's something called long-term acting or long-term medication versus short-acting, short-term medication. So let's talk about how long these medications actually work. There are short-acting options that last about 4 hours, and there's long-acting ones that can last up to 12 hours. But the key thing is, once the medication wears off, it's completely out of their system. Any side effects like loss of appetite or trouble sleeping stop as soon as the medication is out of their system. Now, another common question I get asked is, are there any long-term effects from the ADHD medication? And after more than 50 years of research and hundreds of studies, there's no evidence that ADHD medication causes any long-term effects. And in fact, studies have shown that they might even encourage the brain to adapt and build more dopamine receptors, which is pretty cool. While of course it's still unclear how long those changes last, it's really important to still regularly check in with your child, go to the doctor who prescribed the medication, and see if there have been any changes with your child's behavior or ADHD symptoms in general. Another common question I frequently get asked is if the ADHD medication needs to be adjusted over time. And the interesting thing is, for some kids, the same dose works for years and years, while others might need adjustment over time. Why? It's not just about growing or building that tolerance, it's also about increasing the demands of school and life. So kind of think about it, a 10-year-old tackling multiplication has very different challenges than a 15-year-old prepping for example, finals. Another question I often get asked if ADHD medication can lead to addiction. And the short answer is no, at least studies don't show that. And studies have shown that teens in general with ADHD are at higher risk of substance abuse disorder. However, that is from the ADHD and not the medication. Actually, studies have shown that medication can help to lower the risk of substance abuse, or in general, ADHD treatment has shown to lower the risk of substance misuse or abuse. Of course, it's always very, very important to monitor your child's behavior and how they're taking the medication, if they're taking it as prescribed. And if you ever see any changes happening, it's really important to talk to your child, to your teen, and talk to the prescribing doctor. I know that deciding on ADHD medication definitely isn't easy, and that's absolutely okay. It's all about finding what works best for your child and your family. And remember that ADHD medication is not the only treatment option, and you can also look at a combination treatment approach. And actually, research has shown that a combination treatment approach is the best choice. So that would mean combining different ways of treatment. So ADHD medication plus therapy, or ADHD medication and coaching, or coaching and lifestyle changes and therapy plus medication. So just combining different ways of treatment. If this video helped you, hit the like button, share it with someone who might need it, and subscribe for more tips on parenting and ADHD. Thank you so much for watching, and I will see you next week. Bye.